Impact of poverty on health. Imagine growing up in a society where you are sick more often, can't access health care, and die sooner than children in richer countries. Poverty has a direct impact on health. If you're poor, you're unhealthy. Impact of poverty on health is very prominent. In 2011, more than 1.1 billion people worldwide were estimated to be living on less than $1.25 per day. This is about 1/4 of the population of the world. Many of these very poor people are living in rural areas and are suffering from preventable diseases and conditions that are linked to poverty and disadvantage, such as diarrhea, pneumonia, malnutrition, malaria and parasitic worms. Because children who grow up in poverty have a greater risk of death before they reach adulthood, this cycle of poverty is passed on to future generations. Impact of poverty on man's health. Poverty has a direct impact on men's health. Poor people tend to have more infectious diseases and more maternal and child mortality, higher risks of malnutrition and undernutrition, greater exposure to indoor air pollution from the use of wood, charcoal and dung as fuel, and higher rates of suicide. It is generally understood that the consequences of poverty are not just the result of a lack of monetary resources. Poverty leads to a higher risk for disease, mortality and lower rates of growth in cognitive development for men. Recent studies have reinforced these facts, adding statistical evidence on the correlation between poverty and health. Impact of poverty on women's health. Poverty and its impact on women's health were addressed in 2 papers presented at the United Nations Commission on the Status of Women in New York this spring. Poverty is linked to poor health, resulting from malnutrition, environmental hazards, and gender inequality and discrimination. Poverty not only adversely affects maternal mortality, but it also impedes women's ability to manage their own health, as well as their children's. Impact of poverty on health. Impact of poverty on children's health. The impact of poverty on children's health is undeniable, and experts state that 47 million children do not have adequate access to food, water, sanitation, and hygiene. These factors affect both the health and education of a child. UNICEF reports that in sub-Saharan Africa alone, 1 in 7 children dies before their 5th birthday due to preventable disease. Likewise, the World Health Organization states that up to 500,000 infants die each year due to diarrhea and pneumonia. Especially in poor nations struggling with maintaining healthy conditions for their citizens, improving a child's overall health can increase the likelihood of earning a high school diploma and pursuing further education. Impact of poverty on animals' health. Animal experts have concluded both domestic and wild animals living in poverty are more at risk of contracting fatal diseases. This information is found in a National Geographic article written by Steve Winter about poverty. When it comes to living conditions for animals, if people don't have homes that are clean, we can assume the same is true for animals. This lack of sanitation means animal waste and carcasses are scattered everywhere. Winter stated that disease could be spread via insects and rodents. If animals' health and safety is at risk, further examinations reveal how humans who come into contact with the animals get sick as well. Impact of poverty on aquatics' health. Poverty has both a near-term and long-term effect on the health of aquatic species due to the absence of resources necessary for their survival. Since these animals are more reliant on food, they starve when their habitat is depleted, and they have no access to natural food sources. The lack of adequate supply of resources such as water provides them with an environment where the disease becomes prevalent, which consequently destroys most of their population. Impact of poverty on plants' health. Poverty can have a significant impact on the health of plants and trees. Improper nutrition, disease, and pests are 3 of the most common stressors to plants and trees in developing areas. Agricultural production is not just limited to human health but also to that of the plant. Poorly grown plants are vulnerable to diseases and other problems, including susceptibility to pests. The greatest effects of poverty on plant health are seen with land use change and a shift in farming practices. Land use changes can reduce the environmental capacity for the growth of essential nutrients and habitats for natural enemies, which contribute to higher levels of aphids and spider mites that decrease yield. At the same time, increased poverty leads to fewer insecticides and pesticides, making it more difficult for farmers to control these unwanted invaders. This can lead to significant crop losses that would otherwise unnecessarily occur if farmers were able to get better access to the necessary fertilizer and agricultural technology. Impact of poverty on birds' health. A pair of African weavers achieves less than 10% of their daily nutritional requirements and are underweight, as a result of a lack of food and the scarcity of water for drinking and bathing. The birds are also subject to constant harassment by predators. Although most songbirds depend on insects for their food, many are also important seed eaters. Recent research in the laboratory, in pastures and on farms shows that bird health is closely tied to the quality of the seeds they eat. Some examples of this include worrying about the nutritional effects of pesticides or poor handling of grain before becoming the seed for birds. The symptoms found during medical examination of birds with poor body conditions and low weight varied from one species to another. Impact of poverty on insects' health. Countless studies document the negative health impacts of poverty, not just on humans but also on insects. On days when they are poor, people don't cook, and they often eat cold meals. For bugs like grasshoppers, eating a few junk calories when you can get them means the difference between surviving or dying. Impact of poverty on reptiles is health. Poverty has a greater impact on reptiles' health than it does on humans, as reptiles have a number of body systems that are not used in the same way as humans. These include skin, respiratory and immune systems. These are often taken out of their natural contexts, which means they need to work harder than is ideal for supporting a range of biological processes. The best way to improve the health of these animals is to improve the living conditions that surround them, particularly through diet and housing. Impact of poverty on health in India. The impact of poverty on health in India is a new, fact-filled guide that speaks directly to the health issues that are of greatest concern on the subcontinent. Extreme population drift, growing inequality, and structural changes in the economy have perpetuated India's tradition of poverty and deprivation. Poverty, defined by the World Bank as a condition where families live on less than $1.25 a day, has important and widespread implications for health in India. It is a continuous burden for billions of people, mostly women and children, who work hard to make ends meet but don't see an improvement in their lives or in the lives of their children. Impact of poverty on health in Africa. Today, nearly half the world lives in poverty. Poverty is a major cause of death and disability, with 1 in 3 people dying from a readily preventable or treatable disease. In sub-Saharan Africa alone, over 350,000 women die each year from causes related to pregnancy and childbirth, and approximately 80% of childhood deaths are due to diseases that are easily preventable with proper nutrition or access to health care. Poverty is the largest barrier to health worldwide. Everything that the PEPFAR program does focuses on addressing this fundamental barrier.